Question 1. Stakeholder feedback indicates that a certified compassion fatigue professional, CCFP, has been experiencing persistent headaches, muscle tension, and disrupted sleep patterns for several weeks. They have been attributing these symptoms to the demanding nature of their work and have been attempting to manage them through increased caffeine intake and occasional over-the-counter pain relievers. What is the most appropriate course of action for this CCFP to address their physical symptoms? Option A. Discuss their symptoms with colleagues and seek advice on similar experiences, relying on peer support for management strategies. Option B. Focus solely on implementing additional mindfulness and meditation exercises to manage the perceived stress causing these symptoms. Option C. Schedule a comprehensive medical evaluation with a primary care physician to rule out underlying medical conditions and discuss the potential impact of compassion fatigue on their physical health. Option D. Increase their daily intake of caffeine and continue using over-the-counter pain relievers as needed, assuming these symptoms are a normal occupational hazard. Correct answer is C. Schedule a comprehensive medical evaluation with a primary care physician to rule out underlying medical conditions and discuss the potential impact of compassion fatigue on their physical health. Explanation. This scenario presents a professional challenge due to the interconnectedness of physical symptoms and their impact on a professional's ability to provide effective care, as well as the potential for misinterpretation of these symptoms. The Certified Compassion Fatigue Professional, CCFP, designation implies a commitment to understanding and managing the effects of prolonged exposure to trauma and suffering, which often manifest physically. Navigating this requires a nuanced understanding of both the individual's experience and the professional standards of care. The correct approach represents best professional practice because it prioritizes a holistic and evidence-based assessment of the professional's physical symptoms. This aligns with the ethical obligation of a CCFP to maintain their own well-being to effectively serve others, a principle often embedded in professional codes of conduct that emphasize self-care as a prerequisite for competent practice. It also acknowledges that physical symptoms are valid indicators of distress and require professional attention, rather than being dismissed or self-managed without expert guidance. This approach respects the individual's experience and seeks to identify the root causes, which may include compassion fatigue, burnout, or other underlying health issues. An incorrect approach that involves immediate self-diagnosis and reliance solely on over-the-counter remedies fails to acknowledge the complexity of compassion fatigue and its physical manifestations. This bypasses the professional's responsibility to seek qualified assessment and intervention, potentially delaying appropriate treatment and exacerbating the condition. It also disregards the ethical imperative to consult with healthcare professionals when experiencing significant physical symptoms, which could be indicative of more serious health concerns beyond compassion fatigue. Another incorrect approach, such as ignoring the symptoms with the belief that they are a normal part of the profession, is ethically unsound. This dismisses the reality of compassion fatigue and its detrimental effects on a professional's health and capacity to practice. It violates the principle of self-care and can lead to impaired judgment and reduced effectiveness in client care, potentially harming those the professional is meant to serve. A further incorrect approach, which involves solely focusing on stress reduction techniques without a comprehensive physical assessment, overlooks the possibility that the physical symptoms may have a physiological basis requiring medical attention. While stress reduction is a component of managing compassion fatigue, it is not a substitute for a thorough evaluation of physical well-being. This approach risks misattributing all symptoms to psychological stress, potentially missing critical medical diagnoses. The professional decision-making process for similar situations should involve a systematic approach. 1. Acknowledge and validate the physical symptoms. 2. Conduct a thorough self-assessment, considering the duration, intensity, and impact of the symptoms. 3. Consult with a qualified healthcare provider for a comprehensive medical evaluation to rule out other potential causes. 4. If compassion fatigue is suspected as a contributing factor, seek guidance from a CCFP or other qualified mental health professional specializing in this area. 5. Develop and implement a personalized self-care plan that addresses both physical and psychological well-being in collaboration with healthcare providers. Question 2. Stakeholder feedback indicates that a client, a social worker who frequently deals with child abuse cases, is exhibiting increased irritability, sleep disturbances, and a diminished capacity to empathize with their own family members. The client expresses feeling overwhelmed and questioning their career choice. Considering the principles of secondary traumatic stress theory, which of the following approaches best addresses this situation? Option A. Focus on providing relaxation techniques and mindfulness exercises to help the client manage their immediate stress symptoms without delving into the underlying causes. Option B. Immediately recommend a prolonged leave of absence from their job to allow for immediate rest and recovery, assuming the symptoms are solely due to overwork. Option C. Encourage the client to compartmentalize their work experiences and focus on the positive aspects of their job to foster resilience. Option D. Conduct a thorough risk assessment to explore the client's exposure to trauma, their coping mechanisms, and the impact on their personal life, while considering the potential for secondary traumatic stress and compassion fatigue. The correct answer is D. Conduct a thorough risk assessment to explore the client's exposure to trauma, their coping mechanisms, and the impact on their personal life, while considering the potential for secondary traumatic stress and compassion fatigue. Explanation: this scenario is professionally challenging because it requires balancing the immediate needs of a client experiencing vicarious trauma with the ethical obligation to maintain professional boundaries and ensure the client's long-term well-being. The professional must assess the risk of compassion fatigue manifesting in the client's behavior and its potential impact on their therapeutic progress, while also recognizing that the client's distress may be a symptom of their own unresolved trauma, exacerbated by the therapeutic relationship. Careful judgment is required to differentiate between a client's temporary distress and a more pervasive pattern indicative of compassion fatigue or secondary traumatic stress. The correct approach represents best professional practice because it prioritizes a comprehensive risk assessment grounded in established psychological theories relevant to compassion fatigue and secondary traumatic stress. By utilizing a framework that considers the client's history, current stressors, and the nature of their work, the professional can accurately identify the contributing factors to the client's distress. This approach aligns with ethical guidelines that mandate competent assessment and intervention, ensuring that the client receives appropriate support tailored to their specific needs. It also upholds the principle of do no harm by avoiding premature or misdirected interventions. An incorrect approach that focuses solely on immediate symptom reduction without a thorough assessment fails to address the root causes of the client's distress. This could lead to superficial interventions that do not provide lasting relief and may even mask underlying issues, potentially violating ethical obligations to provide effective care. Another incorrect approach that involves over-identifying with the client's distress, while stemming from empathy, can blur professional boundaries and lead to the professional experiencing their own compassion fatigue or secondary traumatic stress, compromising their ability to provide objective and effective support. This can also lead to a violation of ethical standards regarding maintaining professional objectivity. An approach that dismisses the client's distress as a minor issue without adequate exploration risks invalidating their experience and failing to provide necessary support, which is a breach of ethical duty to care. Professionals should employ a decision-making framework that begins with active listening and empathetic validation of the client's experience. This should be followed by a systematic risk assessment, drawing upon relevant psychological theories such as secondary traumatic stress theory and compassion fatigue theory. The assessment should consider the client's personal history, current life stressors, professional role, and the specific nature of their work. Based on this assessment, a tailored intervention plan should be developed, which may include psychoeducation, coping strategies, boundary setting, and referral for specialized support if indicated. Regular reevaluation of the client's progress and the effectiveness of interventions is crucial. Question 3. The assessment process reveals that a client, a social worker who has been providing intensive support to families experiencing homelessness, describes feeling emotionally drained, detached from their work, and experiencing intrusive thoughts about their client's struggles. They also report a diminished sense of personal accomplishment. Which of the following approaches best reflects an understanding of compassion fatigue and its implementation challenges in assessment? Option A. Dismissing the client's reported symptoms as a normal reaction to a demanding job and advising them to take a short break without further investigation. Option B. Focusing the assessment solely on general burnout indicators and recommending stress reduction techniques applicable to any high-stress profession. Option C. Conducting a detailed assessment to differentiate between compassion fatigue, burnout, and secondary traumatic stress, exploring the client's empathic engagement, emotional exhaustion from caring, and potential vicarious traumatization, while acknowledging the cumulative impact of their work. Option D. Directly diagnosing the client with secondary traumatic stress due to the intrusive thoughts and emotional distress related to their client's experiences. Correct answer is B. Focusing the assessment solely on general burnout indicators and recommending stress reduction techniques applicable to any high-stress profession. Explanation. The assessment process reveals a common implementation challenge in understanding compassion fatigue, the tendency to conflate it with burnout or secondary traumatic stress, leading to misdiagnosis and ineffective interventions. Professionals often struggle to differentiate the nuanced emotional and psychological impacts of prolonged exposure to suffering. This scenario is professionally challenging because accurate identification is crucial for appropriate support and ethical practice. Misinterpreting compassion fatigue can lead to clients not receiving the specialized care they need, potentially exacerbating their distress and hindering their recovery. The correct approach represents best professional practice because it prioritizes a comprehensive, client-centered assessment that specifically targets the unique components of compassion fatigue. This involves recognizing the empathic strain, the emotional exhaustion stemming from caring for others, and the potential for vicarious traumatization without necessarily experiencing direct trauma. Adhering to the CCFP ethical guidelines, which emphasize accurate assessment and evidence-based interventions, ensures that the professional is acting within their scope of practice and providing the most effective support. This approach upholds the principle of beneficence by aiming to alleviate suffering and promote well-being through targeted strategies. An incorrect approach that focuses solely on general burnout symptoms fails to acknowledge the specific nature of compassion fatigue. This is a regulatory and ethical failure because it deviates from the specialized knowledge expected of a certified compassion fatigue professional. It may lead to the application of generic stress management techniques that are insufficient for addressing the core issues of empathic distress and vicarious traumatization inherent in compassion fatigue. Another incorrect approach that equates compassion fatigue directly with secondary traumatic stress overlooks the critical distinction that compassion fatigue can occur without direct exposure to traumatic events, arising instead from the cumulative emotional toll of empathetic engagement. This is an ethical failure as it misrepresents the condition and can lead to inappropriate diagnostic labels and treatment plans, potentially causing harm by not addressing the underlying mechanisms of compassion fatigue. A further incorrect approach that dismisses the client's experience as simply emotional exhaustion without further exploration is a significant ethical lapse. It demonstrates a lack of empathy and a failure to conduct a thorough assessment, violating the professional's duty of care. This can lead to a breakdown in the therapeutic relationship and a failure to provide necessary support, potentially causing further distress to the client. Professionals should employ a decision-making framework that begins with a thorough understanding of the definitions and diagnostic criteria for compassion fatigue, burnout, and secondary traumatic stress, as outlined by relevant professional bodies and research. This framework involves active listening, open-ended questioning to explore the client's experiences, and the use of validated assessment tools. It requires critical thinking to differentiate between similar but distinct conditions, and a commitment to ongoing professional development to stay abreast of best practices in compassion fatigue assessment and intervention. Question 4. The evaluation methodology shows that understanding the historical context of compassion fatigue is paramount. Considering the evolution of the concept from its initial recognition to its current multifaceted understanding, which stakeholder perspective best reflects the comprehensive historical development and its implications for professional practice as a certified compassion fatigue professional. Option A. A perspective that prioritizes only the immediate experiences of frontline workers, without considering the organizational and systemic factors that have historically influenced the recognition and management of compassion fatigue. Option B. A perspective that emphasizes the foundational understanding of compassion fatigue as a direct consequence of exposure to trauma, acknowledging early research while also integrating subsequent developments in understanding its broader impact on individuals and systems. Option C. A perspective that solely focuses on the most recent theoretical advancements in compassion fatigue, disregarding earlier conceptualizations as outdated and irrelevant to contemporary practice. Option D, a perspective that views compassion fatigue as a purely individual psychological response, neglecting the historical shifts in understanding its connection to professional burnout and vicarious traumatization. The correct answer is B, a perspective that emphasizes the foundational understanding of compassion fatigue as a direct consequence of exposure to trauma, acknowledging early research while also integrating subsequent developments in understanding its broader impact on individuals and systems. Explanation: this scenario is professionally challenging because it requires understanding the historical evolution of compassion fatigue concepts and how different stakeholder perspectives have shaped its definition and management, all within the specific regulatory framework of the Certified Compassion Fatigue Professional (CCFP) exam. The CCFP designation implies adherence to a recognized standard of practice, which is informed by the historical development of the field. A deep understanding of this evolution is crucial for accurate assessment and intervention. The correct approach represents best professional practice because it acknowledges the foundational work and subsequent refinements in understanding compassion fatigue. It recognizes that the concept has moved beyond a simple reaction to trauma to encompass a broader understanding of systemic factors, individual resilience, and the ethical responsibilities of organizations and professionals. This perspective aligns with the CCFP mandate to provide evidence-informed and ethically sound support. An incorrect approach that focuses solely on the earliest, most simplistic definitions of compassion fatigue would fail to incorporate decades of research and evolving best practices. This would lead to an incomplete or inaccurate assessment of an individual or organization's experience with compassion fatigue, potentially resulting in ineffective interventions. Ethically, this would be a failure to provide competent care, as it would not be based on the current understanding of the phenomenon. Another incorrect approach that prioritizes only the perspective of frontline caregivers, without considering the organizational and systemic factors, would also be deficient. While caregiver experience is central, compassion fatigue is often exacerbated or mitigated by organizational policies, support structures, and leadership. Ignoring these elements would lead to a superficial understanding and a failure to address root causes. This would be an ethical failure to provide comprehensive support and advocacy. A third incorrect approach that dismisses the historical context entirely and focuses only on current, emergent theories without grounding them in the established understanding of compassion fatigue would be equally problematic. While new research is vital, a complete disregard for the historical trajectory of the concept can lead to misinterpretations and the adoption of unproven or narrowly applicable frameworks. This would represent a failure to build upon established knowledge and could lead to the misapplication of newer concepts. The professional decision-making process for similar situations should involve a critical review of the historical development of compassion fatigue, understanding how its definition, identification, and management have evolved. Professionals must then integrate this historical context with current research and best practices, considering the diverse perspectives of all relevant stakeholders, including individuals experiencing fatigue, their supervisors, and the broader organizational context. This holistic approach ensures that interventions are informed, ethical, and effective. Question 5. Benchmark analysis indicates that certified compassion fatigue professionals, CCFP, must regularly monitor their own well-being to ensure continued effectiveness in client care. Considering the ethical imperative to maintain professional objectivity and client confidentiality, which of the following self-assessment techniques best aligns with the CCFP professional responsibilities? Option A. Continuing to manage a full caseload without any formal self-assessment or seeking support, assuming personal resilience will suffice. Option B. Discussing personal struggles with compassion fatigue openly and in detail with current clients during therapy sessions. Option C. Employing a validated self-assessment tool for compassion fatigue and subsequently debriefing findings confidentially with a supervisor or peer support group. Option D. Relying solely on personal feelings and intuition to gauge levels of fatigue without formal assessment or external consultation. The correct answer is C. Employing a validated self-assessment tool for compassion fatigue and subsequently debriefing findings confidentially with a supervisor or peer support group. Explanation: this scenario presents a professional challenge because it requires the Certified Compassion Fatigue Professional, CCFP, to balance their personal well-being with their professional obligations, a core ethical consideration in this field. The CCFP must engage in self-assessment to identify potential compassion fatigue without compromising client confidentiality or the integrity of their professional judgment. Careful judgment is required to ensure that self-assessment tools are used appropriately and do not lead to biased or inaccurate conclusions about their capacity to provide care. The correct approach represents best professional practice because it prioritizes a structured, evidence-based, and confidential method for self-assessment, utilizing a validated self-assessment tool designed for compassion fatigue, followed by a confidential debrief with a supervisor or peer support group, aligns with ethical guidelines that emphasize professional self-care and the importance of maintaining objectivity in client care. This approach ensures that the CCFP can identify potential issues early, seek appropriate support, and maintain their effectiveness as a caregiver, thereby upholding their duty of care to clients. This is consistent with the CCFP commitment to ongoing professional development and ethical practice, which includes safeguarding one's own well-being to prevent burnout and maintain competence. An incorrect approach that involves solely relying on anecdotal self-reflection without a structured tool or professional consultation is professionally unacceptable. This method lacks objectivity and can be influenced by denial, personal biases, or a lack of awareness of the subtle signs of compassion fatigue. It fails to meet the standard of diligent self-care expected of CCFP and could lead to impaired judgment and compromised client outcomes. Another incorrect approach, such as discussing personal fatigue levels openly with clients, is a severe ethical failure. This breaches client confidentiality, blurs professional boundaries, and can place an undue burden on the client. It undermines the therapeutic relationship and demonstrates a lack of professional judgment regarding appropriate self-disclosure. A third incorrect approach, which is to ignore any perceived signs of fatigue and continue with caseload as usual, is also professionally unacceptable. This demonstrates a disregard for personal well-being and a failure to recognize the potential impact of compassion fatigue on professional effectiveness. It can lead to burnout, decreased empathy, and ultimately, harm to clients. This approach violates the ethical imperative for CCFP to monitor their own health and seek support when needed. A professional decision-making process for similar situations should involve a proactive and systematic approach to self-care. This includes regularly engaging with validated self-assessment tools, seeking supervision or peer support for debriefing and reflection, and being aware of the signs and symptoms of compassion fatigue. Professionals should prioritize their own well-being as a prerequisite for effective and ethical client care, understanding that self-assessment is an ongoing process, not a one-time event. Question 6. The efficiency study reveals a significant increase in reported emotional exhaustion and a decrease in perceived engagement with clients among a cohort of professionals. One professional, Sarah, also reports experiencing intrusive thoughts and nightmares related to specific client cases she has worked on, alongside a growing sense of detachment from her work. Considering the distinct yet related concepts of compassion fatigue, burnout, and vicarious trauma, which of the following represents the most accurate and professionally appropriate initial assessment of Sarah's situation? Option A. The primary focus should be on burnout, as the efficiency study highlights emotional exhaustion and decreased engagement, suggesting a need for workload adjustments and stress management techniques. Option B. Recognizing the combination of emotional exhaustion, detachment, and intrusive trauma-related thoughts, the assessment should focus on the potential for vicarious trauma and compassion fatigue, necessitating a comprehensive evaluation of her exposure to client trauma and its impact, alongside addressing burnout. Option C. The symptoms described are indicative of general stress, and the professional should be encouraged to take a short break and return to work with a more positive outlook. Option D. The situation should be interpreted solely through the lens of the efficiency study's metrics, suggesting that the professional is simply experiencing a temporary dip in productivity that will resolve with time. The correct answer is B. Recognizing the combination of emotional exhaustion, detachment, and intrusive trauma-related thoughts, the assessment should focus on the potential for vicarious trauma and compassion fatigue, necessitating a comprehensive evaluation of her exposure to client trauma and its impact, alongside addressing burnout. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a nuanced understanding of distinct but often overlapping concepts, compassion fatigue, burnout, and vicarious trauma. Misidentifying these states can lead to inappropriate interventions, ineffective support for the professional, and potential harm to both the professional and the clients they serve. The efficiency study's findings, while seemingly objective, can oversimplify complex human experiences, necessitating a careful, person-centered interpretation. Correct approach analysis. The correct approach involves recognizing that the described symptoms, emotional exhaustion, a sense of detachment from clients, and intrusive thoughts related to client experiences, collectively point towards a complex interplay of burnout and vicarious trauma, with potential for developing compassion fatigue. Best professional practice, as guided by CCFP principles and ethical codes, mandates a comprehensive assessment that considers the individual's specific experiences, the nature of their work, and the duration and intensity of their symptoms. This approach prioritizes the professional's well-being and ensures that interventions are tailored to address the root causes of their distress, aligning with the ethical obligation to promote self-care and prevent harm. Incorrect approaches analysis. One incorrect approach is to solely label the situation as burnout. While burnout is present, this label is incomplete as it fails to acknowledge the specific impact of exposure to client trauma, which is a hallmark of vicarious trauma and a precursor to compassion fatigue. This narrow focus risks overlooking the need for trauma-informed interventions. Another incorrect approach is to dismiss the symptoms as simply stress or a bad week. This is a significant ethical failure, as it trivializes the professional's distress and neglects the duty of care owed to them. It fails to recognize the cumulative impact of their work and the potential for serious mental health consequences, violating the principle of beneficence. A third incorrect approach is to focus exclusively on the efficiency study data without considering the qualitative human experience. While data can be informative, reducing the professional's state to mere metrics ignores the subjective reality of their suffering and the ethical imperative to respond with empathy and individualized support. This approach risks dehumanizing the professional and failing to provide appropriate care. Professional reasoning. Professionals should employ a decision-making framework that begins with active listening and empathetic inquiry. This involves gathering information about the professional's experiences, symptoms, and the context of their work. Following this, a differential assessment should be conducted, considering the diagnostic criteria for burnout, vicarious trauma, and compassion fatigue, recognizing their interconnectedness. Interventions should then be developed collaboratively with the professional, drawing on evidence-based practices and ethical guidelines that prioritize well-being, professional development, and the prevention of harm. This process emphasizes a holistic and person-centered approach over simplistic interpretations of data. Question 7. Cost-benefit analysis shows that while addressing a client's cognitive symptoms of compassion fatigue, such as difficulty concentrating and negative thinking, is paramount, a client expresses a desire to meet for a casual coffee outside of their scheduled session to talk things through more informally. As a certified compassion fatigue professional, CCFP, what is the most ethically sound and therapeutically appropriate response? Option A. Immediately inform the client that such requests are outside the scope of professional services and terminate the therapeutic relationship due to the boundary violation. Option B. Gently acknowledge the client's desire for connection, express understanding of their distress, and redirect the conversation back to their therapeutic goals, offering to explore the underlying reasons for their request within the professional session. Option C. Suggest that the client find a friend or family member to meet for coffee, as the CCFP professional time is strictly limited to scheduled appointments. Option D. Agree to meet the client for coffee outside of sessions, framing it as a way to build rapport and provide additional support during their difficult time. The correct answer is B. Gently acknowledge the client's desire for connection, express understanding of their distress, and redirect the conversation back to their therapeutic goals, offering to explore the underlying reasons for their request within the professional session. Explanation. This scenario presents a professional challenge because it requires a certified compassion fatigue professional, CCFP, to navigate the intersection of a client's cognitive symptoms of compassion fatigue and the ethical imperative to maintain professional boundaries and avoid dual relationships. The CCFP must recognize that the client's expressed desire for a personal connection, while stemming from their distress, could lead to a boundary violation if not managed appropriately. The CCFP role is to provide therapeutic support within a professional context, not to fulfill personal needs for companionship or social interaction. The correct approach represents best professional practice because it prioritizes the client's well-being and therapeutic progress while upholding professional ethical standards. By gently redirecting the conversation back to the client's therapeutic goals and offering to explore the underlying reasons for their request, the CCFP demonstrates adherence to principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm. This approach also aligns with CCFP ethical guidelines that emphasize maintaining professional boundaries and avoiding situations that could impair professional judgment or exploit the client. The CCFP is acting to protect the therapeutic relationship and ensure it remains a safe space for the client's healing. An incorrect approach that involves agreeing to the client's request to meet outside of sessions for a casual coffee would represent a significant ethical failure. This would constitute a dual relationship, blurring the lines between a professional therapeutic connection and a personal friendship. Such a breach of boundaries can lead to impaired objectivity, exploitation of the client, and a compromised therapeutic alliance, all of which are detrimental to the client's recovery and violate core CCFP ethical principles. Another incorrect approach, such as immediately terminating services without exploring the client's request further, could be seen as a failure to provide adequate support and could potentially harm the client by abandoning them in a time of need. While boundary setting is crucial, a complete withdrawal without attempting to understand and manage the situation therapeutically is not best practice. It fails to address the client's underlying distress that is manifesting as a boundary-testing behavior. Professional decision-making process for similar situations should involve a careful assessment of the client's expressed needs in the context of their therapeutic goals and the potential impact on the professional relationship. Professionals should consult their ethical codes and, if necessary, seek supervision or consultation from peers to ensure they are making decisions that are both therapeutically sound and ethically compliant. The focus should always be on maintaining a safe, effective, and professional therapeutic environment. Question 8. The efficiency study reveals a significant increase in reported burnout symptoms among frontline caregivers. Which of the following best describes the initial and most crucial step in addressing this trend from a certified compassion fatigue professional (CCFP) perspective? Option A. Recommending that individual caregivers seek personal therapy to manage their emotional distress. Option B. Conducting a comprehensive assessment to differentiate compassion fatigue from general stress and identify specific contributing factors within the work environment and individual experiences. Option C. Implementing a mandatory, standardized resilience training program for all affected staff to equip them with coping mechanisms. Option D. Encouraging staff to take more personal time off to decompress and recover from their workload. The correct answer is B. Conducting a comprehensive assessment to differentiate compassion fatigue from general stress and identify specific contributing factors within the work environment and individual experiences. Explanation. The efficiency study reveals a significant increase in reported burnout symptoms among frontline caregivers. This scenario is professionally challenging because it directly impacts the well-being of those providing care, potentially compromising the quality of services and leading to staff turnover. Careful judgment is required to accurately identify and address the root causes of compassion fatigue, distinguishing it from general workplace stress or individual coping mechanisms. The correct approach represents best professional practice because it aligns with the core principles of the Certified Compassion Fatigue Professional (CCFP) framework, which emphasizes a holistic understanding of compassion fatigue. This involves recognizing its multifaceted nature, encompassing emotional, physical, and spiritual exhaustion stemming from prolonged exposure to trauma and suffering. It necessitates a proactive, evidence-based strategy that includes individual self-care, organizational support systems, and ongoing professional development. This approach is ethically sound as it prioritizes the well-being of caregivers, which is fundamental to providing effective and sustainable care. An incorrect approach that focuses solely on individual coping strategies fails to acknowledge the systemic and environmental factors contributing to compassion fatigue. This is a regulatory and ethical failure because it places the entire burden of management on the individual, neglecting the organization's responsibility to create a supportive work environment. It may also violate ethical guidelines that mandate employers to provide resources and support for employee well-being. Another incorrect approach that dismisses the reported symptoms as mere stress or lack of resilience is a significant ethical failure. It demonstrates a lack of understanding of compassion fatigue as a distinct professional hazard and can lead to the stigmatization of affected individuals. This approach neglects the professional obligation to recognize and validate the experiences of caregivers, potentially leading to inadequate or inappropriate interventions. A further incorrect approach that suggests implementing mandatory, one-size-fits-all training without assessing specific needs or providing ongoing support is also professionally deficient. While training is important, its effectiveness is diminished if it's not tailored to the unique challenges faced by the caregivers, and if it doesn't include mechanisms for sustained support and debriefing. This can be seen as a superficial attempt to address a complex issue, failing to meet the ethical standard of providing meaningful and effective interventions. A professional decision-making process for similar situations should involve a thorough assessment of the reported issues, distinguishing compassion fatigue from other forms of distress. This requires understanding the specific symptoms, contributing factors, and the impact on both the individual and the organization. Professionals should then advocate for evidence-based interventions that address both individual needs and organizational responsibilities, ensuring that support is ongoing, tailored, and culturally sensitive. Adherence to the CCFP Code of Ethics, which emphasizes competence, integrity, and the welfare of those served, is paramount. Question 9. Quality control measures reveal that a certified compassion fatigue professional, CCFP, is using a self-developed questionnaire for assessing compassion fatigue in a diverse client population, without prior validation or peer review. The CCFP believes this approach allows for maximum flexibility in tailoring questions to individual client narratives. Which of the following approaches best aligns with professional standards for the assessment and measurement of compassion fatigue? Option A. Relying primarily on client self-reporting through open-ended interviews, as this is the most direct way to understand their subjective experience of compassion fatigue. Option B. Continuing to refine the self-developed questionnaire based on ongoing client interactions, prioritizing anecdotal evidence and the CCFP clinical intuition for assessment. Option C. Employing a range of psychometrically sound, validated assessment tools that are appropriate for the client's demographic and presenting concerns, while also incorporating a qualitative component to capture individual nuances. Option D. Utilizing a single, widely recognized assessment tool, regardless of its specific validation for the client's cultural background or presenting issues, to ensure consistency. The correct answer is C. Employing a range of psychometrically sound, validated assessment tools that are appropriate for the client's demographic and presenting concerns, while also incorporating a qualitative component to capture individual nuances. Explanation. This scenario is professionally challenging because it requires a nuanced understanding of compassion fatigue assessment tools and their appropriate application within the ethical and regulatory framework governing certified compassion fatigue professionals, CCFP. The CCFP designation implies adherence to specific professional standards and guidelines, which prioritize client well-being, accurate assessment, and the avoidance of harm. The challenge lies in selecting an assessment method that is not only valid and reliable, but also ethically sound and compliant with any relevant professional codes of conduct or regulatory oversight bodies that CCFP are expected to follow. The correct approach represents best professional practice because it emphasizes the use of validated, evidence-based assessment tools that are appropriate for the specific client population and the context of the assessment. This aligns with the ethical imperative to provide competent and effective care, ensuring that interventions are based on accurate and reliable data. Furthermore, it respects the client's autonomy by involving them in the process and ensuring informed consent, a cornerstone of ethical practice in any helping profession. Adherence to professional guidelines for assessment and measurement is paramount for maintaining professional integrity and ensuring client safety. An incorrect approach that relies solely on anecdotal observation or informal questioning, without the use of standardized, validated instruments, fails to meet professional standards for assessment. This can lead to inaccurate diagnoses, inappropriate interventions, and potentially harm to the client. Ethically, It breaches the duty of care by not employing the best available methods for understanding the client's condition. Another incorrect approach might involve using a tool that is not validated for the specific population being assessed, leading to misinterpretation of results and potentially ineffective or harmful treatment plans. This constitutes a failure to practice competently and ethically. Using a tool without considering its psychometric properties, reliability, and validity also represents a significant ethical and professional failing, as it undermines the scientific basis of the assessment and can lead to unreliable conclusions. The professional decision-making process for similar situations should involve a systematic evaluation of available assessment tools. This includes considering the tool's psychometric properties, validity, reliability, its appropriateness for the client's demographic and presenting issues, the ethical implications of its use, and any relevant professional or regulatory guidelines. Professionals should prioritize tools that are evidence-based and have demonstrated efficacy. They should also engage in ongoing professional development to stay abreast of best practices in assessment and measurement. Transparency with the client about the assessment process, including the tools used and the rationale behind their selection, is also crucial for building trust and ensuring informed consent. Question 10. The control framework reveals that a certified compassion fatigue professional, CCFP, is assessing a therapist exhibiting signs of burnout, emotional exhaustion, and a diminished sense of personal accomplishment after prolonged exposure to clients' traumatic experiences. The CCFP is considering different theoretical lenses to understand and address the therapist's condition. Which theoretical approach would best guide the CCFP in developing a comprehensive and ethically sound intervention plan? Option A. Applying a framework that integrates the impact of secondary traumatic stress, vicarious traumatization, and the therapist's personal coping mechanisms and resilience factors. Option B. Utilizing a framework based on the CCFP personal experiences with burnout, without reference to established theoretical models. Option C. Implementing a one-size-fits-all intervention based on a generalized understanding of burnout, irrespective of the specific theoretical underpinnings of the therapist's experience. Option D. Focusing primarily on immediate stress reduction techniques without exploring the underlying psychological mechanisms contributing to the therapist's distress. The correct answer is A. Applying a framework that integrates the impact of secondary traumatic stress, vicarious traumatization, and the therapist's personal coping mechanisms and resilience factors. Explanation. This scenario is professionally challenging because it requires a certified compassion fatigue professional, CCFP, to apply theoretical frameworks to a practical situation involving potential vicarious trauma and burnout in a helping professional. The CCFP must not only understand the theoretical underpinnings of compassion fatigue, but also how to ethically and effectively intervene based on established professional guidelines. The core of the challenge lies in accurately identifying the most appropriate theoretical lens for assessment and intervention, ensuring that the chosen framework aligns with best practices and ethical considerations for supporting individuals experiencing compassion fatigue. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of the individual's experience through a well-established theoretical framework that acknowledges the multifaceted nature of compassion fatigue. This approach allows for a targeted and evidence-based intervention strategy. By grounding the assessment and intervention in a recognized theoretical model, the CCFP ensures that their actions are systematic, ethical, and aligned with the professional standards expected of a CCFP. This adherence to theoretical grounding is implicitly supported by the CCFP commitment to ongoing professional development and ethical practice, which necessitates the use of validated theoretical constructs. An incorrect approach that focuses solely on immediate symptom management, without exploring the underlying theoretical causes of the compassion fatigue, would be professionally unacceptable. This failure would represent a deviation from best practice by not addressing the root issues, potentially leading to superficial or temporary relief. Ethically, it could be seen as a failure to provide comprehensive care, as it neglects the deeper psychological and systemic factors contributing to the professional's distress. Another incorrect approach that relies on anecdotal evidence or personal experience rather than established theoretical frameworks would also be professionally unacceptable. This would violate the principle of evidence-based practice, which is a cornerstone of ethical and effective professional conduct. It risks misdiagnosis, inappropriate interventions, and a failure to meet professional standards. A third incorrect approach that involves imposing a theoretical framework without considering the individual's unique context and experiences would be ethically problematic. While theoretical frameworks provide structure, their application must be flexible and tailored to the client's specific situation. A rigid application can be invalidating and ineffective, failing to address the nuances of the individual's struggle with compassion fatigue. The professional decision-making process for similar situations should involve a systematic approach. First, conducting a thorough assessment to understand the nature and extent of the compassion fatigue. Second, identifying relevant theoretical frameworks that explain the observed phenomena. Third, selecting the most appropriate framework based on its explanatory power, empirical support, and suitability for the individual's circumstances. Fourth, developing an intervention plan grounded in the chosen framework. And finally, continuously evaluating the effectiveness of the intervention and making adjustments as needed, always adhering to ethical guidelines and professional standards. Question 11. Governance review demonstrates that a certified compassion fatigue professional, CCFP, is experiencing significant symptoms of compassion fatigue, directly linked to an unsustainable caseload and a lack of adequate organizational support for managing client complexity. Which of the following represents the most appropriate best practice approach for the CCFP to address this situation? Option A. Continue to manage the current caseload and client complexity without seeking external support or making any changes to their work practices, believing that such challenges are an inherent part of the profession. Option B. Immediately reduce their caseload by a significant percentage without consulting with supervisors or clients, citing personal well-being as the sole reason for the reduction. Option C. Solely focus on implementing personal mindfulness and stress reduction techniques outside of work hours, assuming individual resilience will be sufficient to overcome the challenges presented by the current work environment. Option D. Proactively engage in seeking clinical supervision to explore the impact of caseload and organizational factors on their well-being, and collaboratively develop strategies with their supervisor and organizational leadership to advocate for systemic changes that support a more manageable and sustainable work environment. The correct answer is D. Proactively engage in seeking clinical supervision to explore the impact of caseload and organizational factors on their well-being, and collaboratively develop strategies with their supervisor and organizational leadership to advocate for systemic changes that support a more manageable and sustainable work environment. Explanation. This scenario presents a professional challenge due to the inherent tension between maintaining client well-being and managing personal emotional resources within a demanding work environment. The Certified Compassion Fatigue Professional, CCFP, is expected to uphold ethical standards of care while also recognizing the impact of professional factors on their own capacity to provide effective support. Careful judgment is required to balance these competing demands without compromising either client outcomes or personal sustainability. The correct approach represents best professional practice by prioritizing a structured, evidence-based intervention that directly addresses the identified professional factors contributing to compassion fatigue. This aligns with CCFP ethical guidelines, which emphasize the importance of self-care and professional development as integral components of competent practice. By seeking supervision and implementing systemic changes, the professional demonstrates a commitment to both personal well-being and the quality of services provided, thereby mitigating the risk of burnout and ensuring sustained effectiveness. This proactive stance is crucial for maintaining professional integrity and client safety. An incorrect approach that focuses solely on individual coping mechanisms without addressing systemic issues fails to acknowledge the significant impact of professional factors. This can lead to a perpetuation of the problem, as the underlying causes of compassion fatigue remain unaddressed, potentially violating ethical obligations to maintain a healthy and effective practice. Another incorrect approach that involves reducing caseload without consultation or a clear rationale may negatively impact client access to services and could be seen as an abdication of professional responsibility, potentially contravening ethical principles related to client care and resource management. Finally, an approach that ignores the issue entirely represents a significant ethical failure, as it neglects the professional's duty to self-monitor and address factors that impair their ability to practice competently, thereby jeopardizing client welfare and professional standing. Professionals should employ a decision-making framework that begins with self-assessment and identification of contributing factors. This should be followed by seeking appropriate support, such as supervision or consultation, to gain objective feedback and explore potential solutions. Implementing evidence-based strategies for managing compassion fatigue, which may include both individual self-care practices and systemic interventions, is essential. Continuous evaluation of the effectiveness of these strategies and a willingness to adapt the approach based on ongoing assessment are hallmarks of professional decision-making in this area. Question 12. The risk matrix shows a high probability of significant compassion fatigue among frontline healthcare workers in a busy urban hospital. To develop targeted support programs, a CCFP professional needs to gather in-depth qualitative data on the lived experiences, emotional toll, and coping strategies employed by these workers. Which of the following assessment methods would best achieve this objective while adhering to ethical and professional standards for CCFP practice? Option A. Conducting semi-structured interviews with a diverse sample of frontline healthcare workers, allowing for open-ended questions and follow-up probes to explore individual experiences in detail. Option B. Observing staff interactions and behaviors in common areas for a week without direct participant engagement. Option C. Organizing a single, large group focus group session with all available frontline staff to discuss their general feelings about workplace stress. Option D. Distributing a brief, anonymous online survey with predefined Likert scale questions and multiple choice options to gauge general levels of burnout. The correct answer is A. Conducting semi-structured interviews with a diverse sample of frontline healthcare workers, allowing for open-ended questions and follow-up probes to explore individual experiences in detail. Explanation. This scenario presents a professional challenge because it requires a nuanced understanding of qualitative assessment methods within the specific ethical and professional guidelines of the Certified Compassion Fatigue Professional (CCFP) framework. The challenge lies in selecting the most appropriate method to gather rich, contextual data about the lived experiences of frontline healthcare workers dealing with compassion fatigue, while ensuring the data collected is both valid and ethically sound. Careful judgment is required to avoid superficial data collection or methods that could inadvertently cause further distress to participants. The correct approach, utilizing semi-structured interviews, represents best professional practice because it allows for in-depth exploration of individual experiences, emotions, and coping mechanisms related to compassion fatigue. This method offers flexibility to delve into emergent themes and individual nuances, which is crucial for understanding the complex nature of compassion fatigue. The CCFP framework emphasizes person-centered approaches and the importance of gathering detailed, qualitative data to inform interventions and support strategies. Semi-structured interviews align with this by providing a safe and confidential space for participants to share their stories, thereby respecting their autonomy and promoting a sense of being heard and understood. This method is ethically sound as it prioritizes participant comfort and allows for the pacing of disclosure, minimizing the risk of re-traumatization. An incorrect approach would be to solely rely on a brief, anonymous online survey with closed-ended questions. This fails to capture the depth and complexity of compassion fatigue, reducing individual experiences to quantifiable but potentially superficial data points. Ethically, this approach risks oversimplifying a serious issue and may not provide the necessary support or validation for individuals experiencing significant distress. It also limits the ability to identify subtle indicators of compassion fatigue or the unique contextual factors contributing to it, which is a failure to adequately assess the problem as required by professional standards. Another incorrect approach would be to conduct a single, large group focus group without prior individual assessment. While focus groups can be valuable for exploring shared experiences, they can also be intimidating for individuals who are hesitant to share personal struggles in a group setting, especially concerning sensitive topics like emotional exhaustion and burnout. This could lead to dominant voices overshadowing quieter ones, or participants feeling pressured to conform to group narratives, thereby compromising the authenticity and depth of the data. Ethically, this method may not adequately protect vulnerable individuals or ensure that all voices are heard, potentially leading to an incomplete or skewed understanding of compassion fatigue within the group. A further incorrect approach would be to use only observational methods without any direct participant interaction. While observation can provide insights into behaviors, it cannot fully capture the internal emotional and psychological states that are central to understanding compassion fatigue. This method lacks the direct voice of the individual, making it impossible to understand their subjective experience, their interpretation of events, or their internal coping strategies. Professionally, this would be a significant failure to gather the necessary qualitative data to accurately assess compassion fatigue and develop appropriate support mechanisms, violating the principle of understanding the lived experience of those affected. The professional decision-making process for similar situations should involve a thorough understanding of the research question and the specific needs of the target population. Professionals should consider the ethical implications of each method, prioritizing participant well-being, confidentiality, and the right to self-determination. They should also evaluate the capacity of each method to yield rich, meaningful data that can inform effective interventions. A multi-method approach, combining qualitative and quantitative data, is often ideal, but when focusing on qualitative depth, methods that allow for individual voice and detailed exploration, like semi-structured interviews, are generally preferred for complex issues such as compassion fatigue. Question 13. Assessment of how a certified compassion fatigue professional, CCFP, should ethically and effectively address a client's deeply ingrained introverted personality traits and a tendency towards rumination when these factors appear to be exacerbating their experience of compassion fatigue, considering the CCFP role in supporting well-being without imposing personal change. Option A. Collaboratively explore how the client's introversion and rumination influence their perception of stressors and their coping mechanisms, identifying strategies that leverage their strengths and mitigate potential challenges, while respecting their inherent personality. Option B. Directly advise the client that their introverted nature and tendency to ruminate are maladaptive traits that must be overcome to effectively manage compassion fatigue. Option C. Avoid any discussion of the client's personality traits or coping styles to prevent making the client feel judged or uncomfortable. Option D. Focus exclusively on external stressors contributing to compassion fatigue, disregarding the client's personal factors as outside the CCFP purview. The correct answer is A. Collaboratively explore how the client's introversion and rumination influence their perception of stressors and their coping mechanisms, identifying strategies that leverage their strengths and mitigate potential challenges, while respecting their inherent personality. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified compassion fatigue professional, CCFP, to navigate the intersection of a client's deeply ingrained personal factors and the ethical imperative to provide effective, non-judgmental support. The CCFP must recognize that personal traits and coping styles, while potentially contributing to a client's current struggles, are not inherently wrong or to be fixed in a punitive sense. The challenge lies in fostering self-awareness and adaptive strategies without pathologizing the client's core personality or learned behaviors, all while adhering to professional boundaries and the CCFP scope of practice. Correct approach analysis. The correct approach emphasizes a collaborative exploration of the client's personal factors, focusing on their impact on the client's well-being and their role in compassion fatigue. This aligns with the CCFP ethical obligation, respect client autonomy and dignity. By framing personal factors as areas for understanding and potential adaptation rather than deficits, the CCFP promotes a therapeutic alliance built on trust and acceptance. This approach respects the client's lived experience and empowers them to identify strategies that resonate with their individual makeup, fostering sustainable change. This is consistent with the CCFP commitment to client-centered care and the principle of do no harm, by avoiding judgmental or prescriptive intervention that could alienate the client or exacerbate their distress. Incorrect approaches analysis. One incorrect approach involves directly labeling the client's personality traits as maladaptive and attempting to correct them. This is ethically problematic as it oversteps the CCFP role, which is to support the client in managing compassion fatigue, not to act as a therapist for personality disorders or to impose a specific personality ideal. This approach risks alienating the client, damaging the therapeutic relationship, and potentially violating ethical guidelines regarding professional competence and scope of practice. It also fails to acknowledge that many personality traits, while presenting challenges, can also have strengths. Another incorrect approach is to dismiss the client's personal factors as irrelevant to their compassion fatigue, focusing solely on external stressors. This is a failure to conduct a comprehensive assessment. Personal factors significantly influence how individuals perceive, react to, and cope with stress, including the stressors that contribute to compassion fatigue. Ignoring these internal influences leads to an incomplete understanding of the client's experience and can result in ineffective interventions. Ethically, this represents a lapse in due diligence and a failure to provide holistic care. A third incorrect approach is to adopt a purely passive stance, avoiding any discussion of personal factors for fear of judgment. While avoiding judgment is crucial, completely sidestepping the exploration of personal factors that demonstrably impact a client's experience of compassion fatigue is a disservice. It prevents the client from gaining valuable self-insight and limits the potential for developing personalized coping strategies. This can be seen as a failure to adequately address the client's needs within the scope of compassion fatigue management. Professional reasoning. Professionals should employ a decision-making process that begins with a thorough, non-judgmental assessment of the client's presenting issues, including both external stressors and internal personal factors. The next step involves collaboratively exploring how these factors interact and contribute to the client's experience of compassion fatigue. Interventions should be client-centered, focusing on building self-awareness, developing adaptive coping mechanisms that align with the client's personality, and empowering the client to make informed choices about their well-being. Continuous ethical reflection and adherence to the CCFP Code of Conduct are paramount throughout the process. Question 14. The audit findings indicate a significant increase in reported symptoms of compassion fatigue among the direct care team. As a certified compassion fatigue professional, CCFP, which of the following approaches best addresses this situation to promote long-term team well-being and organizational resilience? Option A. Implement a single, mandatory workshop on mindfulness, with the expectation that this will resolve the team's collective compassion fatigue issues. Option B. Recommend that individual team members seek personal therapy to address their stress and burnout, assuming the organization has limited resources for proactive interventions. Option C. Focus solely on providing immediate crisis intervention for the most severely affected individuals, deferring broader systemic solutions until the crisis has passed. Option D. Develop and deliver a comprehensive training program focused on self-care strategies, stress management techniques, and early identification of compassion fatigue symptoms, coupled with advocating for policy changes that support manageable workloads and adequate supervision. The correct answer is D. Develop and deliver a comprehensive training program focused on self-care strategies, stress management techniques, and early identification of compassion fatigue symptoms, coupled with advocating for policy changes that support manageable workloads and adequate supervision. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified compassion fatigue professional, CCFP, to balance the immediate needs of a team exhibiting signs of compassion fatigue with the long-term sustainability of their well-being and the organization's operational effectiveness. The audit findings highlight a systemic issue, not just individual struggles, necessitating a comprehensive and evidence-based intervention. The CCFP must navigate potential resistance, resource limitations, and the sensitive nature of addressing burnout without stigmatizing individuals. Careful judgment is required to select an intervention that is both impactful and ethically sound, adhering to the CCFP Professional Code of Conduct. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a multifaceted, evidence-based strategy that addresses both the immediate symptoms and the root causes of compassion fatigue. This approach aligns with the CCFP ethical obligation to promote the well-being of those they serve and to advocate for systemic changes that support resilience. By focusing on education, skill building, and the implementation of supportive organizational policies, the CCFP is acting proactively and holistically. This aligns with the principles of professional responsibility to not only identify, but also mitigate risks associated with compassion fatigue, ensuring a sustainable and healthy work environment. Incorrect approach is analysis. One incorrect approach fails to acknowledge the systemic nature of compassion fatigue by solely focusing on individual coping mechanisms. This neglects the organizational factors that contribute to burnout, such as workload, lack of support, and unmanageable caseloads, which are often outside an individual's control. This approach can lead to victim blaming and an inadequate response to the problem, potentially violating the CCFP duty to advocate for supportive environments. Another incorrect approach is to implement a one-size-fits-all short-term solution without assessing the specific needs of the team or the organizational context. This superficial intervention is unlikely to yield lasting results and may be perceived as dismissive of the team's struggles. It fails to meet the professional standard of providing tailored, evidence-informed support and risks further eroding trust and morale. A third incorrect approach, which involves solely relying on external consultants without internal capacity building, is also professionally deficient. While external expertise can be valuable, it does not foster long-term sustainability or empower the organization to manage compassion fatigue independently. This approach can create dependency and fail to integrate compassion fatigue prevention into the organizational culture, which is a core responsibility of a CCFP. Professional reasoning. Professionals should employ a decision-making process that begins with a thorough assessment of the situation, identifying both individual and systemic factors contributing to compassion fatigue. This assessment should inform the development of a tailored intervention plan that incorporates education, skill development, and organizational policy recommendations. Continuous evaluation and adaptation of the intervention are crucial. Professionals must also consider their ethical obligations, advocating for supportive environments, and ensuring that interventions are culturally sensitive and evidence-based. Collaboration with leadership and team members is essential for successful implementation and long-term impact. Question 15. Strategic planning requires a proactive approach to mitigate the pervasive issue of compassion fatigue within a human services organization. The leadership team is considering several interventions to address declining staff morale and increasing service delivery challenges, which are strongly linked to burnout. Which of the following strategies best aligns with a comprehensive, organizationally focused approach to managing compassion fatigue? Option A. Offer voluntary individual resilience workshops and stress management techniques to empower staff to cope with their personal stress levels. Option B. Introduce mandatory weekly individual debriefing sessions for all staff members, regardless of their perceived stress levels, to process challenging client interactions. Option C. Focus on hiring additional staff to reduce immediate caseloads without addressing underlying organizational policies or support structures. Option D. Implement a robust organizational assessment to identify systemic stressors and develop targeted interventions for workload management, supervisory support, and resource allocation, alongside promoting a culture of psychological safety. The correct answer is D. Implement a robust organizational assessment to identify systemic stressors and develop targeted interventions for workload management, supervisory support, and resource allocation, alongside promoting a culture of psychological safety. Explanation. This scenario presents a professional challenge due to the pervasive nature of compassion fatigue within an organization, directly impacting service delivery and staff well-being. The core issue stems from organizational factors that exacerbate individual susceptibility to compassion fatigue, necessitating a systemic rather than purely individualistic response. Careful judgment is required to identify interventions that address the root causes within the organizational structure, rather than solely focusing on individual coping mechanisms. The correct approach represents best professional practice, because it acknowledges and directly addresses the organizational factors contributing to compassion fatigue. By advocating for a comprehensive organizational assessment and the development of systemic interventions, it aligns with the ethical imperative to create a supportive work environment that mitigates occupational stress. This proactive, systemic approach is crucial for sustainable well-being and effective service provision, reflecting a commitment to the principles of professional responsibility and organizational health. An incorrect approach that focuses solely on individual resilience training without addressing systemic issues fails to acknowledge the organizational responsibility in fostering compassion fatigue. This approach is ethically problematic, as it places the burden of managing a systemic issue onto the individual, potentially leading to burnout and a sense of inadequacy when individual efforts are insufficient against overwhelming organizational stressors. It neglects the duty of care owed by the organization to its employees. Another incorrect approach that prioritizes immediate crisis intervention without a long-term organizational strategy is also professionally deficient. While crisis management is important, it does not address the underlying organizational factors that create the recurring crises. This reactive stance is unsustainable and ethically questionable, as it fails to implement preventative measures that would reduce the likelihood of future crises and protect staff from prolonged exposure to high-stress environments. A further incorrect approach that involves implementing mandatory individual debriefing sessions without organizational change is similarly flawed. While debriefing can be a valuable tool, its effectiveness is significantly diminished when the organizational environment remains unchanged. Without addressing issues like inadequate staffing, lack of supervisory support, or excessive workloads, mandatory debriefing can become a perfunctory exercise, failing to provide lasting relief and potentially increasing resentment among staff who feel their concerns are not being genuinely addressed at an organizational level. Professionals should employ a decision-making framework that begins with a thorough assessment of the organizational context. This involves identifying specific organizational factors contributing to compassion fatigue, such as workload, supervisory support, organizational culture, and resource allocation. Following this assessment, interventions should be prioritized based on their potential for systemic impact and sustainability. This includes advocating for policy changes, resource allocation for staff support programs, and fostering a culture of open communication and shared responsibility for well-being. The decision-making process should be guided by ethical principles of beneficence, non-maleficence, and justice, ensuring that interventions are both effective and equitable. Question 16. To address the challenge of compassion fatigue impacting job performance and satisfaction among professionals, which stakeholder perspective best guides the development of effective organizational strategies? Option A. A perspective that focuses primarily on individual professionals' responsibility to manage their own stress and emotional well-being, with minimal organizational intervention. Option B. Perspective that emphasizes comprehensive organizational policies and resources aimed at preventing and mitigating compassion fatigue, including robust supervision, workload management, and continuous professional development in self-care and resilience. Option C. A perspective that views compassion fatigue as an inherent risk of the profession that requires no specific organizational intervention beyond standard employee assistance programs. Option D. A perspective that prioritizes immediate performance metrics and disciplinary actions for any perceived decline in job performance, without investigating underlying causes. The correct answer is B. A perspective that emphasizes comprehensive organizational policies and resources aimed at preventing and mitigating compassion fatigue, including robust supervision, workload management, and continuous professional development in self-care and resilience. Explanation. This scenario is professionally challenging because it requires balancing the needs of individual professionals experiencing compassion fatigue with the operational demands and ethical obligations of the organization. Compassion fatigue can significantly impair job performance, leading to decreased productivity, increased errors, and a decline in the quality of care provided. It also negatively impacts job satisfaction, potentially leading to burnout and high turnover rates. Navigating these issues requires a nuanced understanding of both individual well-being and organizational responsibility, grounded in professional ethical codes and relevant workplace regulations. The correct approach represents best professional practice because it prioritizes a proactive, systemic, and supportive response to compassion fatigue. This involves implementing comprehensive strategies that address the root causes of compassion fatigue, such as workload management, adequate supervision, and professional development opportunities focused on self-care and resilience. Such an approach aligns with ethical principles of beneficence, acting in the best interest of both the individual and the organization, and non-maleficence, preventing harm, as well as any applicable professional standards or guidelines that emphasize the importance of supporting the well-being of those in helping professions. It acknowledges that individual well-being is intrinsically linked to the quality of service provided and the sustainability of the workforce. An incorrect approach that focuses solely on punitive measures or dismisses the impact of compassion fatigue on job performance would be a significant regulatory and ethical failure. This would violate principles of respect for persons and dignity, potentially creating a hostile work environment and failing to uphold the organization's duty of care towards its employees. Such an approach could also contravene labor laws, professional conduct codes that mandate a safe and supportive working environment. Another incorrect approach that involves ignoring the issue and hoping it resolves on its own is also professionally unacceptable. This demonstrates a lack of due diligence and a failure to address a known risk factor that can lead to adverse outcomes for both individuals and the organization. It neglects the ethical responsibility to proactively manage risks and support staff, potentially leading to a breakdown in service delivery and increased liability. Professionals should employ a decision-making framework that begins with recognizing the signs and impact of compassion fatigue. This involves active listening, open communication, and a commitment to understanding the individual's experience. The next step is to assess the organizational context and identify systemic factors contributing to compassion fatigue. Based on this assessment, professionals should develop and implement evidence-based interventions that support individual resilience and organizational capacity. This includes advocating for policies and resources that promote well-being, providing training on self-care and stress management, and ensuring adequate supervision and peer support. Regular evaluation of these interventions is crucial to ensure their effectiveness and to adapt to evolving needs. Question 17. Compliance review shows that a certified compassion fatigue professional, CCFP, has been experiencing persistent insomnia and chronic fatigue, impacting their ability to concentrate during client sessions. The CCFP is concerned about their own well-being and its potential effect on their professional duties. What is the most ethically and professionally sound course of action for the CCFP in this situation? Option A. Continue working as usual, hoping the symptoms will resolve on their own, and avoid discussing their personal health with anyone. Option B. Immediately seek medical evaluation and consultation with a supervisor to develop a plan for managing these symptoms and ensuring continued professional competence. Option C. Attempt to self-medicate with over-the-counter remedies to alleviate the insomnia and fatigue without professional guidance. Option D. Inform clients about their personal health struggle to explain any perceived decrease in performance. The correct answer is B. Immediately seek medical evaluation and consultation with a supervisor to develop a plan for managing these symptoms and ensuring continued professional competence. Explanation: this scenario is professionally challenging because it requires the Certified Compassion Fatigue Professional, CCFP, to navigate the intersection of personal well-being and professional responsibility, particularly when physical symptoms of compassion fatigue manifest. CCFP must balance the need for self-care with the ethical obligation to provide competent and safe services to clients. The regulatory framework for CCFP emphasizes the importance of maintaining professional competence, which is directly impacted by the CCFP physical and mental health. The correct approach involves prioritizing immediate self-care and seeking professional support to manage the physical symptoms of compassion fatigue. This aligns with the CCFP ethical duty to practice within their scope of competence and to avoid causing harm to clients. By taking proactive steps to address their own well-being, the CCFP ensures they can continue to provide effective and ethical care. This approach is supported by the CCFP ethical guidelines, which mandate self-awareness and self-care as essential components of professional practice. An incorrect approach would be to ignore or minimize the physical symptoms, continuing to work without addressing the underlying issues. This directly violates the ethical principle of practicing within one's scope of competence and could lead to impaired judgment, reduced effectiveness, and potential harm to clients. Another incorrect approach would be to disclose personal health information to clients in an attempt to explain reduced capacity, which breaches client confidentiality and professional boundaries. A third incorrect approach would be to self-medicate without professional guidance, which can exacerbate health issues and further impair professional functioning, violating the duty of care to oneself and clients. A professional decision-making process for similar situations should involve a continuous cycle of self-assessment, seeking supervision or consultation, prioritizing self-care, and making informed decisions about professional capacity. When physical symptoms arise, the CCFP should first acknowledge and validate these experiences. Then, they should consult with a trusted supervisor or peer to discuss the impact on their practice. Based on this consultation and their own assessment, they should implement appropriate self-care strategies, which may include seeking medical attention, adjusting their workload, or taking time off. The ultimate goal is to ensure that professional services are delivered with the highest level of competence and ethical integrity. Question 18. Cost-benefit analysis shows that investing in professional development focused on the neuroscience of compassion and empathy can lead to more effective client outcomes in managing compassion fatigue. A certified compassion fatigue professional is considering how to best integrate this knowledge into their practice. Which approach best aligns with current ethical guidelines and evidence-based practice for CCFP? Option A. Prioritizing interventions that leverage understanding of mirror neuron systems and prefrontal cortex regulation to foster self-compassion and emotional regulation skills, while ensuring client consent and tailoring approaches to individual needs and cultural backgrounds. Option B. Relying on popular media portrayals of neuroscience to inform interventions, believing that anecdotal evidence of brain-boosting techniques is sufficient for effective client care. Option C. Advocating for the widespread use of neurofeedback devices to directly stimulate empathy pathways, assuming that technological intervention will universally resolve compassion fatigue symptoms. Option D. Focusing exclusively on the biochemical imbalances associated with stress and trauma, recommending specific supplements or dietary changes without consulting medical professionals to directly alter brain chemistry related to empathy. The correct answer is A. Prioritizing interventions that leverage understanding of mirror neuron systems and prefrontal cortex regulation to foster self-compassion and emotional regulation skills, while ensuring client consent and tailoring approaches to individual needs and cultural backgrounds. Explanation. This scenario presents a professional challenge due to the inherent complexity of applying neuroscience principles to compassion fatigue interventions within the specific regulatory framework of the Certified Compassion Fatigue Professional (CCFP) exam. The CCFP designation implies adherence to a set of ethical guidelines and professional standards that prioritize client well-being and evidence-based practice. The challenge lies in translating theoretical neuroscience findings about empathy and compassion into practical, ethical, and effective interventions that are also compliant with the CCFP scope of practice. The correct approach represents best professional practice because it prioritizes a holistic, client-centered intervention that integrates neuroscience insights with established therapeutic modalities. This approach acknowledges the biological underpinnings of compassion fatigue, e.g., mirror neuron system, amygdala activation, while ensuring that interventions are grounded in ethical considerations, client autonomy, and a comprehensive understanding of the individual's experience. It emphasizes the importance of evidence-based practices, which are implicitly required by professional certification, and avoids oversimplification or misapplication of neuroscience findings. This aligns with the CCFP commitment to providing competent and ethical care. An incorrect approach that focuses solely on neurochemical manipulation, without considering the broader psychological and social context, would be ethically problematic. It risks pathologizing normal human responses to trauma and suffering, potentially leading to over-reliance on pharmacological or biofeedback interventions, without addressing underlying relational and systemic issues. This could violate ethical principles of beneficence and non-maleficence by offering potentially ineffective or even harmful interventions. Furthermore, it might overstep the scope of practice for a CCFP if it involves prescribing or recommending specific medical treatments without appropriate medical referral. Another incorrect approach that relies on anecdotal evidence or unvalidated neurohacks for enhancing empathy would be professionally unacceptable. This fails to meet the standard of evidence-based practice expected of certified professionals. Such approaches could lead to ineffective interventions, wasted client resources, and a breach of professional responsibility to provide competent care. It also risks misrepresenting the current scientific understanding of neuroscience, potentially misleading clients, and undermining the credibility of the profession. A professional decision-making process for similar situations should involve a thorough assessment of the client's needs and context, a critical review of current neuroscience research relevant to compassion fatigue, and the integration of this knowledge with established therapeutic frameworks. Professionals must always prioritize ethical considerations, client safety, and the principle of do no harm. They should also be aware of their scope of practice and seek consultation or referral when necessary. The decision-making process should be iterative, allowing for adjustments based on client response and evolving scientific understanding, always within the bounds of the CCFP regulatory framework. Question 19. Quality control measures reveal that a seasoned social worker, known for their dedication, has recently exhibited increased irritability, withdrawal from colleagues, and a marked decline in their ability to empathize with clients. They have also reported persistent fatigue and difficulty sleeping, attributing these issues to a demanding caseload. As a certified compassion fatigue professional, CCFP, which of the following assessment approaches would be most appropriate to determine if compassion fatigue is a significant factor? Option A. Conduct a structured interview focusing on the specific emotional, physical, and behavioral manifestations of their work experiences, comparing these against established compassion fatigue symptomology. Option B. Immediately refer the social worker for intensive psychotherapy without further assessment, assuming the symptoms are severe. Option C. Discuss the social worker's personal life and relationships to ascertain if external stressors are the primary cause of their current state. Option D. Advise the social worker to take an extended vacation and suggest they focus on personal hobbies to distress. The correct answer is A. Conduct a structured interview focusing on the specific emotional, physical, and behavioral manifestations of their work experiences, comparing these against established compassion fatigue symptomology. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified compassion fatigue professional, CCFP, to distinguish between general job stress and the specific, pervasive symptoms of compassion fatigue. The blurring lines between personal well-being and professional demands, especially in high-stress helping professions, can make early identification difficult. The CCFP must exercise careful judgment to avoid misdiagnosis, which could lead to ineffective interventions and potential harm to the professional. Correct approach analysis. The correct approach involves a comprehensive assessment that looks for a pattern of specific symptoms indicative of compassion fatigue, rather than isolated incidents of stress. This aligns with the CCFP ethical obligation to provide evidence-based and appropriate support. Best professional practice dictates a holistic evaluation, considering emotional, physical, and behavioral indicators, and comparing these against established diagnostic criteria for compassion fatigue. This ensures interventions are targeted and effective, promoting the professional's recovery and sustained ability to provide care. Incorrect approaches analysis. One incorrect approach might involve dismissing the observed behaviors as simply burnout or a bad week. This fails to recognize the distinct nature of compassion fatigue, which is a secondary traumatic stress response. Ethically, this approach neglects the professional's well-being and could lead to the exacerbation of compassion fatigue symptoms if left unaddressed. It violates the principle of beneficence by not actively seeking to alleviate suffering. Another incorrect approach could be to immediately recommend intensive therapy without a thorough assessment. While therapy is often a component of recovery, an immediate, unassessed recommendation can be premature and may not address the root cause or specific manifestations of the professional's distress. This could be seen as a failure to exercise due diligence and could lead to unnecessary financial or emotional burden on the professional. A third incorrect approach might be to focus solely on the professional's personal life outside of work, assuming the issues are unrelated to their professional role. Compassion fatigue is intrinsically linked to the demands and emotional toll of caregiving. Ignoring the professional context would be a significant ethical lapse, failing to acknowledge the direct impact of their work on their well-being and violating the principle of non-maleficence by not addressing the source of harm. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough, non-judgmental assessment. This involves active listening, observation of behavioral changes, and inquiry into the professional's experiences within their role. The CCFP should then compare these observations against recognized signs and symptoms of compassion fatigue, considering the duration, intensity, and impact of these indicators. Based on this comprehensive evaluation, a tailored intervention plan can be developed, which may include education, self-care strategies, peer support, or professional counseling. This process ensures that interventions are evidence-based, ethically sound, and responsive to the individual's unique needs. Question 20. Consider a scenario where a certified compassion fatigue professional, CCFP, has been working intensely with a population experiencing significant trauma for over a year. They begin to notice a decline in their own emotional responsiveness, increased irritability, and a growing sense of detachment from their work. They are aware of the potential for compassion fatigue, but have not engaged in any formal professional support systems since starting this role. Which of the following represents the most ethically sound and professionally responsible course of action to mitigate the developing compassion fatigue? Option A. Increase personal self-care activities like exercise and hobbies, assuming that individual resilience will naturally overcome the emerging symptoms. Option B. Discuss their feelings only with close friends and family outside of the professional field, hoping for emotional release and perspective. Option C. Immediately schedule regular, facilitated supervision sessions with a qualified mental health professional experienced in working with trauma professionals, and actively participate in peer support groups specifically designed for helping professionals. Option D. Minimize client contact and take an extended vacation, believing that distance will resolve the issue without further professional intervention. The correct answer is C. Immediately schedule regular, facilitated supervision sessions with a qualified mental health professional experienced in working with trauma professionals, and actively participate in peer support groups specifically designed for helping professionals. Explanation: this scenario presents a professional challenge due to the inherent emotional toll of working with individuals experiencing significant trauma and distress. Compassion fatigue is a recognized occupational hazard for helping professionals, and its impact can impair judgment, reduce empathy, and lead to burnout. Therefore, robust professional support systems are not merely beneficial but ethically and regulatorily mandated to ensure the well-being of the professional and the quality of care provided. The correct approach emphasizes proactive and structured engagement with professional support. This aligns with the ethical principles of self-care and professional responsibility, which are foundational to maintaining competence and preventing harm to clients. Specifically, seeking regular, facilitated supervision with a qualified professional provides a safe space to process difficult emotions, gain objective feedback, and develop coping strategies. This is often implicitly or explicitly required by professional codes of conduct and licensing bodies that expect practitioners to maintain their mental and emotional health to effectively serve their clients. It also directly addresses the CCFP focus on preventing and mitigating compassion fatigue through structured support mechanisms. An incorrect approach would be to rely solely on informal peer conversations without a structured framework. While peer support can be valuable, it lacks the professional guidance and objective perspective that a trained supervisor offers. Without a facilitator, peer discussions can devolve into commiseration without problem solving, or worse, reinforce maladaptive coping mechanisms. This fails to meet the standard of care expected for managing occupational stress and can be seen as a dereliction of professional duty to seek appropriate support. Another incorrect approach is to isolate oneself and avoid seeking any form of support, believing that personal resilience alone is sufficient. This is a direct contravention of ethical guidelines that promote self-awareness and the proactive management of personal well-being as it impacts professional practice. Such isolation exacerbates the risk of compassion fatigue and can lead to impaired judgment, potentially harming clients. It demonstrates a failure to recognize the systemic nature of compassion fatigue and the need for external support structures. Finally, an incorrect approach would be to engage in superficial or infrequent support that does not adequately address the depth of emotional challenges. For example, attending an occasional workshop without ongoing support mechanisms would be insufficient. This approach fails to provide the consistent, sustained support necessary to effectively combat the cumulative effects of compassion fatigue. It represents a failure to implement a comprehensive strategy for professional well-being, which is essential for long-term effectiveness and ethical practice. A professional decision-making process in such situations should involve a continuous assessment of one's emotional state, an understanding of the demands of the role, and a proactive commitment to utilizing established support systems. This includes recognizing the signs of compassion fatigue early, understanding the available resources, supervision, peer support groups, personal therapy, and making a deliberate choice to engage with these resources regularly and meaningfully. The CCFP framework underscores the importance of these proactive measures as integral to professional competence and ethical practice.